physical therapist.
And I'm Brad Heineck, physical
And
therapist.
together we are the most famous physical therapists on the internet.
Oh, in our
In
opinion,
opinion.
yes. So what are we going to talk about today, Bob?
Brad, you had a hint on how to help increase the flexion or the bending of a knee after you've had a knee replacement.
Right, and this is one of those things where
It's a pearl,
It
right?
is.
It's a pearl of
It's
wisdom.
a pearl. I never knew what that meant, pearl. What is it? It's a little tidbit of knowledge that you're going to really appreciate if you have your knee done and you want to get to bend more with less pain.
So right now though, we're going to switch out here because apparently you don't want me
I
to
cannot.
serve as your subject. So
Right, I need someone else to help me out, Bob.
Nancy's going to come on out, I'm going to get behind the camera.
I don't want to hurt your feelings, Bob.
Yep, you're heading out.
Okay. I want to take your shoe off. That way we know it's the.
Both of them or just the one?
Just that one.
Okay.
Are you ready, Bob?
I'm an excellent cameraman, by the way. Okay, go ahead. We're ready.
We're ready.
Yeah, we've been running the whole time.
Okay, here we go. Total knee. Nancy's helping us. She's usually behind the camera. This is going to be the knee that had the surgery done. Okay, total knee replacement. When you get home, almost invariably, all therapists are going to say you've got to get that knee moving, and they say you got to wax the floor. So what you're going to be doing is going back and forth just to get that knee moving. Typically, within a week after surgery, you get about to here, and it hurts a lot, and you cannot pull your foot back anymore unless you go through some pain. Okay? As a therapist, when I first see a patient, this is one of the things I found out works really well. I did not invent this. Another one of the therapists taught me this when I was about 15 years ago when I was just getting started. Is you take your hands like this. Another person, you know, I've had spouses do this or family members do this to their family member or friend who's had the knee replacement, is you take your hands and you grab right around the knee gently, okay? Your middle fingers will go right in the crease of the knee. Back here we call it the popliteal fossa, otherwise just the back of your knee. And your forearms are going to go on your thighs. And you're going to grab here and you ask the person, you just have to have them relax. Okay, Nancy, I just want you to relax. Pretend that your leg is just like jello. There's no muscles in it. Take a deep breath and just let it relax. And I'm just going to lift it up like this. And you simply start to bounce it very gently. And at that point, the patient will look at me and say, geez, that feels kind of good, a little grin on their face. And then I'll go back and forth this way. Now, Bob, can you pan in on that knee? And this is exactly what will happen, is you'll get the knee to be relaxed. And once they get relaxed, you can start to float the knee back and forth. And then you bounce it, go back and forth. And I'll usually gain 5 to 10 degrees of flexion on this with very little pain, and the person's actually happy. And part of the reason is because they learn to relax, and when the quadriceps relax, it allows the knee to bend more. And you do this for about 2 to 3 minutes. Usually, depending on the size of the person and the size of the leg, I'll go until my hands get tired. Smaller person, you can go longer, but you're not going to do this for 10 or 15 minutes straight by any means. It's usually just 1 to 3 minutes. And at that point, you can go off and continue with your exercises or their ice packs. Now, we've got a number of videos on little pearls or tidbits that are really going to help improve your knee motion with less pain and make the whole rehab process much better. So look at our other videos and actually subscribe to our videos. And we have a number of other things besides total knee replacements, from shoulders to neck pain, back pain, you know, everything but a broken heart pretty much we can fix. So very good. Thank you.